everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. One of the most common issues that I see in my clinic every day is shoulder restriction following breast cancer treatment. Now, sometimes people can be coming in 6 weeks after their surgery, sometimes people can be coming in years after their treatment's completed, but it's a really common problem. And in this video, I'm going to show you a really simple technique that might help you get your shoulder moving following treatment. And please subscribe to my channel, which is completely free. Give this video a big thumbs up and leave a comment in the section below if you have any questions on how to improve your shoulder range of motion after breast cancer surgery. Okay, so as we said, one of the biggest issues following breast cancer treatment can be restriction in your shoulder range of motion. And one of the most common areas that people's shoulders become restricted is this section of tissue at the back of the shoulder blade. So this soft tissue area, which is mainly made up of muscle, can become extremely tight and restrict how you lift your arm. And it can even restrict movements like putting your hand behind your back, washing your hair, putting things in an overhead cupboard, all sorts of functional activities like that can make a really big impact on your quality of life day to day. So what we do is we use one of the most simple treatment tools on the planet, a tennis ball. Yes, that's right, believe it or not, the good old tennis ball is something that I'm pulling out of my clinic cupboard every day of the week, giving it to breast cancer patients to help their range of motion in their shoulder. Now, we don't go and send you off to play a game of tennis, but in just a moment, I'll show you exactly how to use this to enhance your shoulder range of motion. I just want to put a quick note in here, guys, to say that if you are just following breast cancer surgery and you're just trying to get your shoulder range of motion going, then this video might be a little bit advanced for you. The video that I'll direct you to is called Range of Motion Exercises After Breast Cancer Surgery. I'll just put a little card link to that video in the top left-hand corner here now. So if you're just following surgery and if you're in the first couple of weeks after breast cancer surgery, I'd advise you to go and watch that video first. The technique or the treatment technique that I'm about to show you in this video is more directed for patients who've followed breast cancer surgery. They're 4 to 6 weeks post-op and their shoulder is still a little bit stiff and stuck, or patients who have still got a really tight, stiff shoulder months or even years following their breast cancer treatment. This video was actually inspired by a patient that I saw earlier today. So a big shout out to Kathy, who had her breast cancer treatment in 2015, so 6 years ago at the time I'm filming this video. And she still had a lot of pain in her arm that tracked basically from the shoulder blade down to the back near the elbow. And all we did was loosen up the tissue on the back of her shoulder for 5 to 10 minutes. And I gave her this exercise to take home. And she had a huge reduction in her pain that she'd had to put up with for a long time. So how do we perform this treatment technique? So literally we place the tennis ball, say if we're treating a tight right shoulder, behind the shoulder blade and against the wall. I apologize for a little bit of the shadow here, guys, that will form when I'm filming this. We rest our hand on the opposite shoulder, and then literally all you do is massage that soft tissue with the tennis ball. You can go back and forth and up and down. So you can bend at the knees and do little movements up and down. You can go side to side. You may have to reposition the ball a couple of times just to get it into the right place. And I must point out here that you are searching for the tight, uncomfortable spots. So if this is absolutely pain-free, then this might not be what's restricting your shoulder. But most of the time when people have some sort of shoulder restriction, it would be unusual not to find a little bit of tension in the back of the shoulder blade. Not for everybody though, but most people. So all you need to do is massage that ball and find the tight spots. Now, a word of warning here, guys. The pressure that you put into the ball is going to dictate how much tolerance you have to this exercise. What I mean by this is that when you start this exercise, you may find that if your shoulder is tight and you're pushing putting pressure on the tennis ball, that this will be quite a tender exercise to do. So if you can't tolerate any pressure on the back of your shoulder blade with this tennis ball, this might not be the exercise for you. It might be a good idea to go and seek help from a physiotherapist, occupational therapist, or even massage therapist who has some experience treating breast cancer patients, so they can gently start to break up the tissue tension for you first, and then you may find your tolerance to the tennis ball improves. So consider doing that first if you can't tolerate the ball at all. One of the best tips I can give you though for this exercise is to make sure that when you first start, your feet are close to the wall that you're putting the ball against. If you place the ball against your shoulder blade, rest your hand on your opposite arm, and you step away from the wall, essentially, so you're more on a diagonal line, you're going to be putting a lot more pressure through the tennis ball. Whereas if you're more upright, so if my feet are close to the wall and my body is parallel to the wall, then I can really put quite a light pressure. Here's another little tip for everyone playing at home. If you find it difficult to keep the ball against the wall, if you continually find the balls just dropping onto the floor, one of the easy tricks you can do is put the tennis ball in an old sock or a stocking, and then at least you can hold that tennis ball. So once it's positioned here, you can then hold onto the sock or the stocking, and it'll save you having to pick up the tennis ball 100 times when you first try starting this exercise. Another thing my patients would definitely like to know when it comes to this exercise is how long you should perform the exercise for. I would always encourage people to stick to a maximum of 60 seconds with this exercise, and then coupled with that information, I would also recommend that you stick to an absolute maximum of twice a day to perform this exercise. The reason I'm quite strict with my patients about only performing this exercise a maximum of twice a day is because if you continually put a lot of pressure on the tennis ball against your shoulder blade, then you're probably going to end up making it sore because it's going to get a bruisey feeling about it. So make sure you're short and sweet with this exercise, making sure that you stick to a maximum of twice a day and a duration maximum of 60 seconds per massage session. Another thing to consider, as I mentioned before, with this tennis ball exercise to improve your shoulder range of motion after breast cancer surgery, is that it would be a really good idea to complement this treatment technique and get to a lymphedema physiotherapist, an occupational therapist, or a massage therapist that has had experience treating patients with breast cancer. It's a fantastic thing to get the physiotherapist or whichever allied health professional is treating you to loosen up the tissue for you. That will give you a really good kickstart forward with getting increased range of motion in your shoulder. I would also like to point out here though that if your pain and stiffness in your shoulder really do persist and you've been seeing a physiotherapist and you've been performing range of motion exercises, or you've tried the tennis ball trick and it really isn't working, there may be other issues going on with your shoulder that you're not aware of. If this is the case, definitely head back to your medical team, head back to your physiotherapist, and ask for further investigation on your shoulder. There's plenty of circumstances by which patients following breast cancer can end up with secondary issues in their shoulder, such as bursitis or frozen shoulder. Bursitis is one of the most common things that I see following breast cancer, and I've actually done a video on that called Why Does My Shoulder Hurt? So I'll just leave a link to that video here, guys, so if you want to go and check that out, please do so, because you may be thinking, well, what if there is something extra going on with my shoulder beyond just a little bit of muscle tension or soft tissue tightness. Thank you so much for watching this video, everyone. I hope you've really enjoyed it and gained some great information. This video is the first video in a series I'm going to be doing called Improving Your Range of Motion After Breast Cancer. So stay tuned for more videos on this topic. I hope you're having a fantastic week wherever you are. Stay tuned for the video next Tuesday. I'll see you then. I'm Jen McKenzie, the Breast Cancer Physio.